Hello, everyone. This is Dr. Klimek from Our Special Village, and I'm here today to talk to you about a topic that's been brought to my attention a lot lately. In the last couple of weeks, I've talked to quite a few parents that have been really worried about whether they should pursue a diagnosis for their child or not. And when I'm saying, pursuing a diagnosis, I'm really referring to pursuing a diagnosis for a child that's younger than 3 years old. So for most of these children, they're really hovering around 18 months to 30 months of age. So that's a few months before they turn three. In some cases, quite a few months before they turn 3 years old. Um, and the issue is really not that straightforward. And I wanted to address this today because um, there are so many different opinions in this matter. So usually when we talk about diagnosis and we talk about young children, we have two sets of opinions. There is the one set that says, let's wait it out and see. Children are young and children can get a lot of different stimulation, interventions. There are so many things that we can do for them that waiting for a little while, it's really not that bad. And then there's the other train of thought that says, let's diagnose now, let's get that diagnosis, and then try to implement whatever services we can get within a diagnosis. I usually advocate a happy medium. And what's a happy medium? Um, and I'm saying this in a general sense, of course. There are sometimes when I say waiting is the best option, and sometimes I say diagnosing right away is the best option. In today's world, we see most of diagnoses following within the autism spectrum disorders range, which is why it's a spectrum. So a lot of the services will be provided to you or to your child. If your child falls within this diagnosis, it's not the only one, but it's definitely the most salient one and the one that's going to get you most of the services. So what happens when you fall within a happy medium? I always say if your child will really fall within that within the spectrum, your child will fall within the spectrum in 3 months. So why not try to do everything we can in the next 3, 4, 5 months, even 6 months? And if your child does not respond, or we see that things are getting worse, then maybe it's a good time to pursue a diagnosis. Or maybe we go 1 month, 2 months, and we say we probably need to pursue a psychological evaluation and pursue a diagnosis. Sometimes I've seen totally the opposite. We wait for a little while, and all the red flags that we used to see when we first started treatment disappear or are much less noticeable. And this is when waiting actually pays off, and we see that the interventions that we created are yielding some results. In every case, what's most important is you as a parent and the treatment that's being given. So whether your child does or does not have a diagnosis, the most important thing for a family is to get together with the therapists that are providing early intervention and do devise a program where you are present or are aware of what's happening during the sessions and can carry it over to your home and to daily life. So I will be talking a little more about this topic later on. I believe it's a very important one, and I've been getting so many questions about this. And as always, if you have any questions for me or would you have a comment and would like more information about a certain issue, you can always drop me a note. But I will be seeing you very soon and we'll continue talking about this. Bye.